So I'm Abigail Hefer. I am a licensed clinical social worker. I've been working in the field of social work for almost 20 years now. My largest chunk of my clinical experience is in medical social work, and I love it. And it's really what compelled me to open up my therapy practice, because the thing that I loved the most about the work that I was doing was the counseling aspect, the education piece, the holding space for people and letting them talk about their struggles. Yeah, I love the work that I do. I'm passionate about it. I like working with the older population just because I feel like I've learned a lot from them over the years. The majority of my clinical work has been working with people over the age of 65. I worked in hospice for 5.5 years, and I got to see a lot of different ways of aging and the dying process. And I feel like the benefit to the community with this is how we learn how to live, how to age. Aging isn't something that's taught. It's just something that we experience and we witness other people go through it. And we don't really know what it's like until we're in it. And working with the dying population, it's, people have questions about what's the meaning of my life? How is this going to serve anybody? And especially as people get older, it's just looking for this desire for purpose. And so if I can take what I've learned and relay it to somebody else who is experiencing something similar, then that's a benefit. That's how I can help their legacy live on. The biggest challenge, or some of the bigger challenges for seniors regarding mental health, is just overcoming the stigma around having issues. In my work with folks, I've seen a lot of, I'm new to this. I thought I was over this. I thought I didn't need to deal with this. I thought I had dealt with it. Some of the other things that I hear are just the challenges around technology. Finances can also be a challenge for seniors. I think the biggest advice that I would have for people is just talk to your insurance. Find out what's there. If you have people in your life who understand how to use technology, reaching out to them and seeing if they might be able to help you with getting onto a call. I've worked with several folks who had a child, a spouse, a friend, get them set up for a telehealth visit. There's a way to make it work. Some of the challenges that I faced with working with Medicare patients, technology can be a challenging one for some folks. It can be really helpful, especially for those who are homebound or are in a facility. But definitely the biggest asset for those folks is just having somebody who's able to assist them with the technology when they're struggling with it. Another challenge that I've run into for some folks is transportation. I have had a client who their daughter would bring them in for sessions, and client felt guilty about taking time away from their child's work schedule. And so just lots of reassuring them that their children want to help them and support them in it. Some of the other challenges are if their kids are the ones that are really pushing them, reminding them that they have a choice, that the client has a choice, that it's up to them if they want to do the work. And then sometimes those children might also want updates about how their parent is progressing and have you talked about these things. And so I just really try to reflect back to them, to the children of this individual, that it's their parents' journey. I can't control how and what they process. The other thing that I really try to do too is talking with my client about what they're comfortable with me sharing with their adult children, especially if there is a disclosure for them. Another piece that I try to do is advocate for the client's wishes and needs. I tend to talk a lot with folks about their quality of life, what they want their aging process to look like, facing all of their frustrations and challenges with their own adult growing up experience and processing how they might have failed with their children, trying to understand why things are the way that they are now, and just trying to help the client realize that there is still time and room to repair things, that there is still time to process and create a new narrative about the hurts of their past. Another big thing that I feel just needs to be understood is that there are a lot of folks out there who are aging that are dealing with financial challenges, and they often don't know what they don't know about their insurance or their options for their insurance. And so just encouraging people to connect with someone who can help them navigate understanding their insurance differently to cover different benefits. I would say at least half of my clients have been from Medicare, and I see 18 to 20 folks in a week. That's what I've been averaging since I started full-time with my practice, which I think is pretty great if you're trying to build your caseload. The great thing that I love working with Mindful is just that there's people that I can reach out to for support if I have a question about billing, that sort of thing, getting clarification. I would say the majority of the folks that I've worked with on Medicare, I haven't dealt with like a delayed payment or anything like that. There's been like a few folks here and there, but they're really just like one-off kinds of situations. So as far as that goes, I feel like it's a really great venue for a stable client base as far as like payments go. And again, the Mindful folks are just so helpful with navigating it all if I have questions. So I guess the other thing that I would say about Medicare expanding client base is when I do work with folks and I get connected with them, I hear a lot from them about how it was hard to find somebody who took their insurance, had availability. The reality is the aging population that we are seeing, these folks have likely been to therapy at some point in their life. Some of them might even be therapists who are looking to talk to somebody. It's just a growing population and it needs to be served. Do it. I would encourage you to accept Medicare. The stories that you can learn from these folks is fantastic. You know, I'm in my 30s. Some of these folks come in and they meet with me and they're just like, what do you know? You're young. And that's when I get to, pull out my hospice card of, well, I've worked with a lot of people over the years. I've seen some stuff. But the other piece of it is our understanding of helping folks who've experienced trauma, helping folks who have alcoholism in their family or who had abuse. I've had people in their 70s and 80s come in and talk with me about their childhood trauma, and we look at how it impacted things. There are skill sets out there that have been cultivated and further developed over the years since these folks might have accessed therapy, might have been open to therapy, and we can still help. People want help. People want to age with peace of mind. But if we can do that and help these folks, why not? The benefits that I see when clients are able to access care, a lot of times it's, why haven't I worked on this before? Or they tell me about changes in their relationship with their kids, their grandkids, their spouse. Just there can be freedom in changing a narrative for yourself. Some of my folks that I've worked with have been facing end of life, and getting to talk with them about their feelings around it, getting to talk with them about what their wishes are as they face their final days, and helping them create language to talk with their family about what they're concerned about, what they're wanting, what they're needing help with. Other folks that I've worked with, some of them have been dealing with, they've gotten diagnosed late in life with like ADHD or dealing with past relationship issues with their own parents, and getting to see how that's changed their relationship with their adult children. I get to help people make sense of the hurt and the pain, and to give them a way of modeling to their children that it's not too late, that it's okay to apologize, that it's okay to recognize our shortcomings and our failures, and that it can actually be a way of deepening those relationships.